Welcome. My name is Paxton Dickerson. I am a registered addiction specialist, a certified chemical dependency counselor, and I'm here to talk to you about post-acute withdrawal, also known as the PAW equation. It is a group of symptoms that occur after acute withdrawal. Acute withdrawal being specific withdrawal from drugs or alcohol. So, after you begin to recover and you have no drugs or alcohol in your system, it is the adjustment period that your brain has to make in the process of returning to life without chemicals. So, to continue our discussion on post-acute withdrawal, I'll first have to get you familiar with what post-acute withdrawal means. I don't feel right. I got 3 weeks into recovery and I'm losing it. Why do I feel like this? I don't like this at all. Well, my sir, that's probably because you're not familiar with the post-acute withdrawal equation, the PAW equation. The PAW equation is predisposing factors plus precipitating factors equals post-acute withdrawal syndrome. Imagine a dry field and you drop a match. Well, the field being dry would be the predisposing factors. The precipitating factor would be the match being dropped, and post-acute withdrawal syndrome is the fire. Predisposing factors. The first, high-stress personality style. It can be any personality style that is conducive to high stress. A compulsive liar, a rageaholic, a type A personality, a procrastinator, even a perfectionist. Second, high-stress lifestyle. Here comes a drug addict and alcoholic. It could be a single parent or a job that includes a commission or a quota. Social conflict or instability is the third. Here come legal problems or having conflict with society in general. Physical health problems, pre-existing, newly acquired because of an accident or tragedy or as a result of drug and alcohol use. The last is my favorite. It is an inadequate recovery program. This dictates that there are inadequate recovery programs and adequate recovery programs. It could be any program that does not involve tools for your recovery, such as peers or a sponsor or meetings. It could be a program that says you can use drugs or alcohol as long as it's not your drug of choice. Any inadequate recovery program will fit this purpose. Here comes the precipitating factors. Internal triggers and external triggers. Internal triggers are things that come from inside, and external triggers are things that come from external forces. The internal triggers are thoughts, what you're thinking, emotions, what you're feeling, memories, past emotions and thoughts, and future projections, future emotions and thoughts. And then the second part of the precipitating factors is the external triggers. Funny enough, they are the three things that a recovering addict and alcoholic cannot control and needs to accept. Peoples, places, and things. Persons, situations, and events. You add any one of the predisposing factors to any one of the precipitating factors, and you get post-acute withdrawal. Post-acute withdrawal includes thought process impairments, rigid repetitive thoughts, thoughts that will keep on attacking you over and over and over again. I gotta go, I gotta go, I gotta go, I gotta go. This is bad, this is bad, this is bad, this is bad. I want this, I want this, I want this, I want this. The inability to complete a logical chain of thought. A, B, and therefore C becomes very confusing. The inability to see cause and effect. I will treat someone bad yesterday and have a problem with them treating me bad today, not seeing their actions as a reaction to my behavior. Inability to see organized themes and principles. And the 12 steps of Alcoholics Anonymous is one big organized theme. the inability to set priorities, poor time management, the inability to see abstract reasoning, and spirituality, the search for a higher power, is all abstract reasoning. Those are the thought process impairments. Emotional impairments. There are three: overreaction, underreaction, emotional numbness, and of course, reactions with no reason at all. The next is short-term memory impairments. Tendency to forget information learned within 20 minutes. Also, difficulty learning new skills and information. It could be making your way around a new town, returning to jobs and forgetting your obligations and duties, or in some cases, forgetting people's names. The next symptom can be tricky. It's stress sensitivity. Very intermittent. It comes and goes. During periods of high stress, all the other symptoms will get worse, and in periods of low stress, they'll almost seem to disappear. One of the other symptoms that can plague a newly recovered addict and alcoholic is sleep disturbances. It can be insomnia or interrupted sleep. It can also just be going to sleep and not feeling rested once you wake up. This last symptom is where the term dry drunk came from. Coordination problems. The newly recovered addict and alcoholic will have difficulty balancing, running, or possibly any other physical activity. So those are the symptoms which create the syndrome of post-acute withdrawal. Hopefully by investigating them, you can see what, again, I'm going nuts. I don't feel right. In my head, in my heart, I feel uncomfortable in my own skin. I cannot stay sober like this. I did not get into recovery to feel like this. Which leads me to the second PAW equation, which is post-acute withdrawal minus effective symptom management will equal the 10 phases of relapse. You'll end up entering the relapse process if you cannot correctly address these symptoms. I will teach you the symptom management tools for that purpose. Luckily for you, those tools are things that you should be doing in your recovery anyway. Oh, and by the way, please pull up your pants. And here are the recovery tools, which you should be familiar with anyway. Stabilization. This is returning to the people that got you sober in the first place. It can include 90 meetings in 90 days, basically upping your involvement in the program in general. Verbalization. Getting thoughts out of your head and out of your mouth. Let you hear yourself speaking to other people, calling your sponsor, sharing in meetings, talking with friends. Ventilation. This will also include journaling, praying, getting your emotions out. Reality testing. Not taking your own perception as truth, bouncing your ideas off of other people. Maybe not for permission, but in case they have a better idea. Education. That would just be learning about this whole process like you are right now. Nutrition. 4 food groups. 3 meals daily, and staying hydrated. Self-protective behavior, defending your sobriety, not going to slippery places, and not associating with people who use or drink. Exercise. This can be working out, running, wiggling, just moving about and staying active. It could also be dancing. Relaxation. Learning how to calm yourself. Learning how to meditate. Learning how to bring yourself back, not just sleeping. Spirituality. Spirituality in itself is removing you from being the center of your own universe. And what a great burden lifting thing that is. And balanced living. Doing all these things with balance. Not doing all of one and none of the other. Keeping balance and returning your recovery to being the thing that stabilizes you in your life. This has been post-acute withdrawal and the PAW equation. My name is Paxton Dickerson. Thank you very much.